Nursing home licensed practical and vocational nurses. It is time to stand up in honor of your license. Let me say that a little louder. Nursing home licensed practical and vocational nurses. It is time to stand up in honor of your license. Were you aware on May 10th of this year, the Center for Medicare and Medicaid Services, also known as CMS, our healthcare government regulators, finalized a Biden-Harris administration staffing ratio initiative specifically excluding licensed practical and vocational nurses, the staff who manages the most critical aspect in residents' care. Medications. As a matter of fact, the Federal Registry notes in the Biden-Harris administration's proposal, we are not setting a minimum staffing standard for LPN LVNs. This proposal was based on a study conducted by ABT Associates contracted by CMS. It states, quote, the 2022 nursing home staffing study did not demonstrate an association between LPN, LVNs, HPRD at any level and safe and quality care. The staffing study focuses on registered nurses that has minimal interest in nursing home employment. The study includes predictability that a registered nurse is required to reduce hospitalizations, emergency room visits, and optimize care. There is no dispute that registered nurses are truly more educated than a licensed practical and vocational nurse. However, a licensed practical and vocational nurse staff ratio alone would rectify the alarming hospitalizations, emergency room visits, and will optimize care. Ironically, according to Berman and Riddell attorneys at law, Georgia nursing home medication error rate alone is at 46.5%. As licensed practical and vocational nurses strive to manage medications, appointments, families, treatments, staffing oversight, assessments, and day-to-day documentation, and much more. And who knows how many medication errors go unreported, with or without results of medically related illnesses. Yet the studies show no association between LPN, LVN related to safety and quality of care. This is just a snippet of what research will reveal on the high rate of unreported medication errors, legal litigations related to medication errors, and licensed practical and vocational nurses who have faced legal litigations related to medication error. Yet the studies show no association between LPN, LVN related to safety and quality of care, according to a study conducted by ABT Associates. Well, what better time than now to introduce you to the nurse's key factor in safety delivery of care in a nursing home, the medication card. Before we get started, we will take a look at these key factors involved for the nurse's journey in a nursing home. Medication cards in a nursing home are a major necessity in the nurse's journey, and they are built for nursing home medication management. Take a look at them. Irrespective to styles and sizes, this is the biggest safety factor in a nursing home. I challenge you just to imagine the journey that licensed practical and vocational nurses face as they journey through a daunting day that can include medications for 26 or more residents alone.
Do ba 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 do boo do a boo ba.
Key factors in the medication management is polypharmacy, tube feedings, the high number of diabetics and diabetic management, the number of residents that are receiving eye drops. And let's not forget to include patches, creams, injections, inhalers, and nasal sprays. And all too often pre-medication, where the nurse has to obtain a blood pressure and pulse or heart rate before administering a medication. Nebulizer breathing treatment, IV medications.
Now I must ask you, what is your stance? What is your plan for LPN LVNs handling the most critical part of nursing home care and services and being exempt from staffing ratios? What is your stance today? Because this is only a snapshot of what these nurses encounter in nursing homes around the world.